All right. Well, good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. And I want to thank everyone for jumping up early and being on this call because you're going to get this information first before everyone else in the world. I love it. So, why we were here besides earning a paycheck and helping those that need it most. We are here to improve the lives of our community with affordable health care. Thank you for doing that. Thank you for everything that you do out there. The world needs you. Insurance is confusing. People make bad decisions. Their health is in jeopardy, and that's the only wealth that we have, or at least some folks, that's all they've got. So really appreciate your hard work. We're in training season right now. We're in certification season right now. And we're going to talk a lot about that this morning. So let's dive into the training deck here. We have training this week. Lots of things going on. Now, remember, in the middle of this, we have certifications, right? We're going to talk about that this morning. 2024 Medicare certifications are starting to roll out. Those of you that are doing ACA, the 2023 FFM training has closed, and they're preparing for the release of 2024, which should happen either later this month or early in August. So we'll start to see the FFM training for ACA. We'll talk more about that here in just a bit. But here we are. So first and foremost, Stan in the chat here is saying happy birthday to me. It's not my birthday, for the record. Mine was last month, so if you missed it, that's okay. But we do have two birthdays at Health Plan Markets this morning, two very important people. I see one of them's on the call. Happy birthday to Mr. Nick Street. He's finally 21, so if you see him somewhere, you can buy him an adult beverage. You can finally have one. Congratulations to Nick. Happy birthday. And then also he shares a birthday with Lena Salazar, our broker manager. So happy birthday to Lena. Happy birthday to Nick. Lena, I'm so sorry that you have to share a birthday with Nick. Anyway, I hope you guys have a fantastic birthday. Thank you for all you do. I think actually Lena's on PTO. She's smart. She doesn't put it. Yeah, she's not putting up with me today. Good for her. Okay, so let's dive into training, guys. Remember, we've got certification season here, but in the meantime, you've got some incredible trainings on the training deck I want to make sure that you guys are aware of. Today at 1 o'clock, United Healthcare is doing an advanced diabetes training. So, this is really key if you're doing CSNPs, incredible opportunities to learn more. They're going to talk about their supplies and what they do for their diabetic patients. Also today, you've got Cigna doing a Medicare Advantage product overview for new brokers. So if you have not sold a Cigna policy yet, or if you're looking for, or if you're new to Cigna, this is a great opportunity to get in front of the trainers and then also learn about that product. If you've been contracted with some of these carriers, but you haven't sold one yet, this is a great opportunity for you to get in front of that. We have a special guest this morning from AvMed. We have Eddie Cooper, who's on the line. And so he's going to be talking about AvMed Medicare for you folks, and we're going to put together some trainings as well, so you can get in front of him as well. So, if you haven't done these products, or if you haven't had a chance to offer them, or even deep dive, this is a great opportunity for you to do so. Also at 4 o'clock today, United Healthcare is doing a virtual office hours. So if you have any questions, concerns, rude remarks, they're available at 4 o'clock today. Moving over to tomorrow, the 11th, United Healthcare is doing a Medicare supplement training. It's a coffee and chat session, virtual. So I guess that's bring your own coffee, BYOC. That's at 9 o'clock tomorrow. Also tomorrow, you've got Humana doing a Help Simplify Medicare for Veterans. There you go. Okay, veterans are a huge part of the community for Medicare. Getting in with the veterans. If you need ideas, please, reach out to us. We're happy to help. United Healthcare is also doing a new agent training. So if you're new to United, or if you haven't sold one in a while, this might be a good opportunity for you to jump into that tomorrow at 11. And then also United Healthcare is backing it up with a DSNP training, and that's at 12 o'clock tomorrow as well. So if you want a full UHC experience for tomorrow, from 9 to 12, they're doing a bunch of different stuff that you can jump into. Jumping to Wednesday the 12th, Ask Al virtual coffee. Bring your own coffee. 9:30, he's on the line to answer any questions that you have about any products. If you need help with marketing, if you are lost, if you're confused, if you don't know what to do next, please reach out to Al, 9:30 on Wednesday. He will put up a guide. This is your personal trainer. Think about that. You go to the gym, you spend $300 a month to have a personal trainer. You have Al. He is your insurance personal trainer. He will make you bigger, stronger, faster, make you more money. Take advantage of Al, okay? He's going to be there at 9:30 on Wednesday, virtually. There we go. Wednesday at 11, super busy. You've got Cigna doing office hours, and it looks like United Healthcare is building a business plan. That's a question. Do you have a business plan? People don't plan to fail, they fail to plan, okay? Plan it out. What does your AEP look like? Guys, we're within 90 days of the next open enrollment period. Do you have a plan of action? What are you doing? Are you doing lead gen right now? I'm going to talk a little bit about that today too. Humana is doing tools and resources to help you market. There it is. That's on Wednesday at noon. Huge opportunity there. And then you've got a training with Cigna for brokers at 4 o'clock on Wednesday. Thursday, United Healthcare is doing their training with their toolkit. That's at 2 o'clock on Thursday. They're also doing a backup training at 4 o'clock that same day for the supplemental benefits on the Medicare Advantage plan. You can actually add some additional benefits. If you don't know that, get to that training. Friday, United Healthcare, new agent orientation for United Healthcare. Again, if you're new to United, this is a great opportunity to jump in there and do that. That's at 1 o'clock on Friday. And then they're hosting virtual office hours at 3 o'clock on Friday as well. That's the training for the week, guys. Remember, keep one foot in the classroom and the other one in the field at all times. Like I mentioned before, we are in recertification season, which means that you need to recertify for all the carriers that you certified for 2023. It's now open for 2024 for several carriers. I spent a beautiful Sunday afternoon doing my AHIP, and it was a lot of work, and there was a lot of time required to do these things. Don't wait to the last minute. Get it done now, okay? Chop it away. Even if it takes you an hour to do a module, just chop it away, okay? So I want to point out on the Gold Key, just as a reminder, I'm putting in the chat, joinhpm.com/Gold Key. That is your resource for all of the great things that we are talking about today. You'll see contracting here. Recertification for 2024 is on the top left corner there. You're going to click that, and I'd like to say thank you to Gabe for putting this together. We've got little cards here for all of the carriers that have launched their 2024 recertification, which includes AHIP 2024. So you just simply click that AHIP there, and boom, step-by-step instructions on how to get through your AHIP. So there's the link to the AHIP. You get a $50 discount. That is through Devoted, so we're just using their link for that. When you log in, though, if you've done your recertification last year with a different carrier, it's going to prompt you, do you want to log in under that same carrier? If that's easier for you, fantastic. Go ahead and do it. Pretty much all carriers have that $50 discount, so don't worry too much about it. But I do want to make sure that you guys are aware you got to watch it and make sure it's $125. If you pay the $175, it's going to be near impossible for you to get a refund. Okay, so just pay attention, make sure that that discount's been applied at the shopping cart. Your total cost should be $125 there. When you're done with your AHIP, you have to send a copy to us. Send it over to contracting@askhpm.com. I do know the team is working on an upload site for all of your certifications. That's coming soon. But also on AHIP, I want to show a couple of things. On the drop down here, you can actually earn some CE credits. I think I paid $31 yesterday for 5 CE credits. So you do that over 2 years, that's 10 credits that you don't have to sit through. It's worth $30 to me. I don't know, maybe not to you. Anyway, you need to do continuing education search there. So there's the link there. Also, I downloaded all of the slide decks there for you for easy training guides. So there you go. These are not tests. These are not answers. Don't ask. You need to learn. You need to take the test and you need to pass it. We will not be cheating. We will not be passing answers around because that is not what this is about. If you're out there in the community helping people, you need to know what you're talking about. Okay? So these are the guides that Medicare provides. So just click that and you have the modules there, module 1, 2, 3, 4, 5, and you've got trainings. My favorite feature is Control F. So if you're looking up a certain topic, you can type that topic in on any of these PDFs and you should be able to find that topic, read more about that topic, and do what you got to do. Okay. Fantastic. Also, you'll see that all the emails here have been set up for training. So for instance, Devoted is ready to rock. So when you click Devoted, there's the email that everybody got for onboarding. It's beautifully right there. All the links are there. So if you have any questions on how to get started, just reach out to us. But it should be pretty simple for recertification here. And we're slowly adding these carriers into the Gold Key as we move forward. So please watch for that. Quick security update. It does look like my email was hacked over the weekend. So some of you may have gotten weird messages from a 310 number. That is not me. I do not own a 310 number. We've seen some things like it's asking for Apple gift cards or for you to go out and buy Apple gift cards. Just be very careful with that. We're working to, we've already changed the password to the email and we're working an investigation on this right now. It doesn't look like any damage has been done other than somebody's trying to get you guys to buy some Apple gift cards. So just pay attention to that. It has nothing to do with what we're doing. I hope nobody's become a victim of that. And if you have, please reach out to us. You can give us a call and we'll do what we got to do to get it straightened out. Okay. Other than that, please let me know if you have any issues with your emails. It does look like the team is already on it. They've been working through the weekend to ensure that no other damage has been done other than contact information there for agents. So just pay attention to that. All right, let's jump over to, we've got a contest that was rolled out by Wellcare last week. They're sending people over to the Hard Rock Cafe Hotel in Daytona Beach. How do you qualify? You got to submit 3 Wellcare apps between July 5th and August 31st. And you get 1 raffle entry. It's automatic. You don't have to do anything. This is for 1099s only. And what do you win? You win a weekend getaway at Hard Rock Cafe Hotel at Daytona Beach. And that's going to be between September 29th and October 1st. So right before AEP, you get a nice little weekend there. It looks like the raffle drawing will be held on September 11th by Zoom. So if you're doing Wellcare apps, you need 3 to get a raffle ticket and you'll be entered automatically. So be on that Zoom call, check your emails, and you got that going on. Couple last updates here. Just want to make sure that you guys save the date. September 22nd is our AEP kickoff. You will be invited to Dub's Dread Golf Course. We are hosting our 2024 AEP kickoff. I think we're going to call it a tee-off for this year just because it's golf themed and that's fun. But I definitely want to make sure that you guys save that date, September 22nd. Very, very important. And there you go. Last note before I turn it over to Ed is we've got Healthfirst in the market for ACA products, and they are expanding into Central Florida for ACA products, okay? So they are going to be entering Orange, Osceola, and Polk counties in this market, and then over in the Pasco market as well. This is big news for the ACA market. If you're doing ACA and you have not yet contracted with Healthfirst, this might be a really great opportunity if you're selling in the Central Florida market. That almost doubles their footprint for ACA in Central Florida. So very strong product there. You can learn more about that. We're going to have them on a call soon, but they have redone some incredible branding and a lot easier and cleaner to read and get contracted with. So if you have questions on that, reach out to the contracting team. And with that, I'd like to welcome our special guest, Mr. Ed Cooper with AvMed, and he is going to get you guys up to speed on what's going on with AvMed on the Medicare side. Good morning, Ed.
Good morning. Thank you for allowing me to join your team here. Amazing information that you've shared. That's sounds all great. I love how efficient everything is with your company here. It's great.
Well, I appreciate that. Yeah, you got to do it rapid speed.
Awesome. So for those of you that know us, hello. For those of you that do not, I'd like to share a little bit about AvMed. We've been around for 54 years in the South Florida market. We are exclusive to Florida. We're not national. We're kind of more boutique style, I want to say. We have over 200,000 in membership. However, January 1st, we were under one umbrella. Now we're under another umbrella. A company took us over by the name of Centera. They're based out of Virginia. They own 12 hospitals and a health insurance plan, or carrier, I should say, up in North Carolina. Their membership's 1.2. They do group, individual, and Medicare like us. And an additional thing that they do that they're going to be bringing down to us is Medicaid. So more than likely for 2025, we will be able to offer dual SNP. This year, however, it's core. We're in Miami-Dade, Broward, Palm Beach. We are also in Orange, Osceola, and Seminole counties. To give you an idea in regards to plans in that market, it's going to be one plan that we have there. So it's going to be very nice and simple, not a lot to go over there. We have really good benefits in regards to additional benefits for like vision and hearing. We have some tools for you guys on the marketing side. And I think that was something that Justin had shared with me that would be important to share with you guys. And if you give me a second, I want to share my screen so you guys could take a look at it. I should have practiced this one.
It should be at the bottom there. It says share.
Yeah, I got it.
Okay.
It was like too many screens I have up, I guess.
We're good.
Yeah. So currently, right here, Orange, Osceola, and Seminole. And I'm showing you this because I believe this is like the main market maybe that you guys are in, correct?
Mm-hmm.
All
Yes.
right, cool. Just to go over, none of our plans have premiums, zero deductible, max out of pocket on this plan. Currently, it's $3,000. This is for 2023. For 2024, it's going to change. But if we have anybody on the call or any of your agents interested in getting contracted, even though we're closed, we might be able to make an exception for you guys to get, a few of you guys on currently. If you have, some type of business or think that you could write. Referrals are required on this plan. This PCP is 0, specialist is 20. That's for this year. Next year, there's going to be a drop in that considerably. So that's going to be very positive to the members and to the agents as well, I guess, right? Being that we'll be more in par with what's going on in that area. What I wanted to show you is, here's our vision allowance. So with vision, there's an allowance of $450. There's also something added to this that the member could choose between 60 or 70 Lux brands. So besides getting this one frame, their allowance of $450, they get a free frame for themselves as well. And they could use this allowance for contacts if need be as well. Hearing's $1,000 an year. OTC's 100 every 3 months, and transportation's unlimited. And still trying to get to where I wanted to for you guys in regards to the marketing. Getting there.
Yeah, while you're looking for that, Ed, quick question: is there any preferred doctor groups or partners up in the Orlando or Central Florida area that you see that are really keen on AvMed?
So Conviva, I believe it's Conviva up there. Centerwell, excuse me. Thank you. Centerwell is one, and Orlando Health is the other. Are the two major ones that we're working with.
Yeah, we have a pretty good working relationship with Centerwell and Conviva right now, so that's good to know.
Perfect. Trying to get here. Maybe if I could share, how do I share my my website or my screen where I'm currently working?
I think if you hit share again and then one more time to link it on, you can select a different screen. Should give you an option to select a different one. So, guys, if you are interested in
Yeah.
contracting with AvMed Medicare, you can shoot an email over to contracting@askhpm.com. I will say, like Ed mentioned, that the contracts are going to be limited at this time. So that's why I asked about the provider groups. If you're working with Centerwell right now, if you're doing events with Centerwell, or you've got some things going with Centerwell, then it may be a really good opportunity for you to contract with AvMed, knowing that they're wanting to grow the AvMed portion of their business. So just a little hint there that there might be some opportunities available for you if you're working with Centerwell. So
Thank you. Thank you for that. Very true.
mhm.
Entire screen, maybe this is it. Yeah, I'm going to share this one here. So you need to gain
Yep.
access, right? So am I sharing it?
Yeah, you're good.
All right, cool. So those of you that are interested in marketing materials for AvMed, it's our asset management tool. You need to gain access. So once you become appointed with us or contracted, there's an extra step to get into this. But you could just shoot me an email and I'll include my contact information so you could take a look at it. But we have a lot, and they continue to keep updating this for us. Medicare sales support, there's brochures, flyers. I'll click on this. Well, actually, I could just scroll down here. So these are good maybe for like doctor's offices, right? Or leaving, around town in different locations. We have them in English and Spanish as well. And they're customizable. So you're able to put your face on here, company information, company logo, whatever it may be, and be able to share this. And we have them also not only for Medicare, but for IFP as well. And it's all CMS approved.
Awesome. Yeah, I saw that you have some social media ads on there too, which is really great. Because that's somewhat cheap as far as posts and things are going on. So these are really nice. You don't have to get them approved, guys. You can just download them and get them customized. Ed, is there any cost for the physical assets like the flyers or the pull-up banners or things like that?
So the pull-up banners, that's something that we would need to order for you guys.
Mhm.
In regards to these assets here, this would be something that would be printed on your end at this
Mhm.
time. But we do have other brochures that we could send you guys that are trifolds that would be beneficial. They kind of like break down how the plans work and the added benefits to it as well.
Awesome. And to dovetail to this, as far as the social media and the ads here, guys, if you are interested in running your own social media advertisement campaign, we have incredible training that can help you with that. Casey on our team can help you set up an ad. We also have Nick Ferrante, who's a new employee here at Health Plan Markets, and he is running our Facebook ads. He's done some experimentation over the last 3 months. It was painful experimentation. Facebook is not as easy to run as I thought it was, but we're at a point now where we're kind of getting dialed in, which is really fun. So if you need help or you're interested in doing your own social media campaign and investing in that and getting leads from Facebook, look at what we've got with AvMed already. I mean, it's out of the box ready. All you got to do is customize it and we can get it launched today. It's that quick. So rather than having to design your own stuff, which takes time, and then we got to send it up for approval, and it goes back and forth to get a code. It could be AEP by the time you get it approved. So stuff like this is a huge win when it comes to marketing. So thank you for showing us that, Ed.
Yeah, absolutely. A couple other things I'd like to share. One of them being seeing that we are local here, we're neighbors. We are able to get things done a little bit, I want to say more efficiently. I hope that's not insulting to anybody. But what I mean by that is, we have contacts to all the executives. So if, the agent has an issue for one of their members, whatever it may be, they could reach out to me or one of their service reps, whoever's handling their account. And, we have phone numbers to people that we could get in touch with, even over weekends, right? That things come up. I had a story, somebody needed to get their nephew surgery, an ear surgery, and there was a backup with some type of approval process. And Fortunately, I was able to reach out to the right people internally, and by Tuesday, the kid was having the surgery. Right. So
Amazing.
it was
Yeah.
something that made me feel really good being able to get that done so quickly. At some of the other nationals, you got to jump through a lot of hoops, right, to get things done. But with us, we're a couple touches away to get, make things happen in essence. And
Yeah,
then
that's great.
one of the other things I'd like to mention, we do have something called RX Saving Solutions, which is something that the members can sign up for. How this works is if they're prescribed the medication and there's a savings that's available, there's a third party that researches all the claims that are hitting like the pharmacies and stuff, and they'll look and see if there's maybe, instead of a tablet, a pill format that maybe could be upped and cut. And if the member agrees, they will reach out to their provider, have the provider sign off on it, and then it'll be sent to the pharmacy, right? There's some cases, there's one example, this lady needed glaucoma, and she was going to be charged X amount of dollars. Basically, by making this change, there was a savings of over $2,500, right?
Wow.
Not only to her, but also to the company, right? So in total, which is huge, right? And they're able to pick that up. And if it works the same for the patient, right, we're getting the authorization from the provider, the doctor, it makes sense. So that's something that we provide to the members as well.
Is that service done automatically, or is there anything that the member or agent has to do?
The member just has to click a few buttons to agree to either CMS text or receiving the emails. And then if there is a difference, right, or a savings that's potential, I mean, that's a big example, but, it might be $20, $30, whatever it may be. It might be that instead of going to CVS, the member should go to Publix, right, for that savings, right, for example. The member then has the option to either agree with it, yes, I'm interested, or not do anything, and then it'll stay the same, right? So maybe for the $20, or like, you know what, I don't want to bother with it. The doctor told me I needed this, right? I want to stay with it. But if the potential savings is more, right? Maybe they're like, yeah, you know what, I want the doctor to check this out. They'll click on it, and then they'll go through the process, and then they'll be notified. I remember with me, not with RX Saving Solutions, but my father, I took him to a doctor's appointment. The doctor prescribed something, and they had the pharmacy right there. He had Humana at the time, and not meaning, I think it's great. I like, all carriers and whatnot. But so anyways, I went to the thing, and it was $500 and something for this medication. And I was like, oh, wow, shoot, that's kind of pricey. Purchased it, right? Went home, got on Google and did a search and saw that there were other options. So I reached back out, and the doctor's like, yeah, no problem. We could switch it for something else. So then the following month, it went from $500 to $35, right? That's something I did. This does it automatically for the member. So
That's cool. Great.
Yeah,
that's great. We do have a question in the chat here. AvMed is one of the health coverage options for state of Florida employees. Do they offer a MAPD designated or designed for those employees who retire from state employment and want to continue their AvMed coverage?
So there isn't anything currently designed for them particular. It's the same plans that we currently do have. And that's a great point that they bring that up. That's a pretty large account, right, on the group side, the state of Florida. Down here in South Florida, we have like Miami-Dade County, Jackson Hospital, AT&T, and Marriott, to name a few of the larger ones. And, one of the great things that we could benefit from on some of those groups, right? Because some of them we're not able really to follow up on and touch. It's something based in what's in the contract, but are for those people that are aging in. And that's something that's great for you guys as well to look into, right? If you have groups or individuals, keeping note of who might be aging in, so you could follow up with them. And what we've noticed is people are reaching out more than 12 months ahead of time, right?
Yeah.
So like even like a year and a half, making those touches. And, it's funny, somebody might receive something and be like, I'm not 65 yet, right? But it's just like that first touch, they remember, and then boom, you keep, connecting with them, and then, you're able to make that sale or get that call back.
Absolutely. And guys, remember, you have a system that does the automatic touches. We have automatic newsletters, emails, text messages. All you have to do is put those prospects in the Spark platform, and the automation does all that for you. So just remember that you need prospects, right? So there's a great segue to a strategy that's year round, where you can actually go to mid-size or large employers. And if you hit one that has AvMed, hey, what are you doing with all your people turning 65? Are you sending them away? Do you have a specialist? And you could become that specialist that, they exit through the gift shop, which is you. You're the gift shop, right? And you save money on the carrier side, because it gets really expensive if the member stays on the plan past 65. You transition them to an AvMed plan, a Medicare Advantage plan. They can keep it and go wherever they want, and when they retire, they get to keep it, right? It's not tied to the employer. And so all of that is a really great strategy for you to go and get T65s every month. If you go and find these corporations, it takes some time and a little bit of street pounding, but if you hit one or two of those, you could have a feeder system of leads for years as you become the expert.
And I'd like to add something I think would benefit your agents. A lot of people focus on providers, right? Doctors' offices and whatnot. There's also like dentists, or like the hearing.
Yeah.
If there's something out there that's really hot and great. I mentioned this. It doesn't necessarily have to be with AvMed. It could be with any other carrier. And they're working with it. You could get referrals that way as well from the provider's office. But naturally, we're talking about AvMed. One other thing worth mentioning that's going to be beneficial, we have had field benefit consultants, so AvMed internally. If somebody calls the call center, we have a call center. But if somebody wants to meet a member in person, we've had field benefit consultants go out to meet with them. That's going to be changing. We're going to be going out in the market, doing events, going to providers' offices, etc. And when we get leads, basically those leads are going to be shared with our preferred GAs and FMOs. So it's going to be more or less like a one-for-one. You provide us with new member, right, application. We'll be able to provide one back to you. And it's going to be like a hot lead, right? Not something that's cold. So
it's amazing. There you go, guys. You heard it from Ed. You've got an opportunity to get some leads. So if you're interested in getting contract, reach out to the contracting team, contracting@askhpm.com, or you can email any of us. We'll get you to the right place, or give us a call. You guys know the number there. Ed put his contact information in the chat there. It's edward.cooper@avmed.org. But if you don't snag it in time, you can reach out to us and we'll connect you with Ed at any point in time. So, Ed, thank you very much for your time this morning. I really appreciate the run and gun style. This is awesome.
Awesome, man. Thank you so much for the opportunity to be here, and for everybody's time, and happy selling. Thank you.
Thank you very much. All right, guys, that's it for today. I really appreciate everyone's time and attention. Remember, these calls are being recorded and they are on YouTube about 3 days later. So guess what? You got all the information first. Please remember to try to be on these calls every Monday at 9 o'clock. As we get closer and closer to AEP, you're going to want the information faster. You don't want to wait 72 hours to get the information when all of your other co-agents got it first. So there it is. Thank you very much for your time and attention. Have a fantastic week.